They can cause early miscarriages. They can end up in having a recurrent pregnancy loss. Sometimes the patient may have pain only. Sometimes the patient may not have pain, but infertility will be the main issue. They will be mentally also suffering a lot.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. 𝑧𝑵 protects your skin.
Good evening, dear friends. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle, a talk show with the expert doctors of Al Hilal hospitals and medical centers. In the last episode, we were discussing about endometriosis. We will be continuing our discussion with Dr. Aisha Anjuna, the specialist obstetrician and gynecologist from Al Hilal Hospital, Moharak branch. What are the treatment options you have beyond painkillers?
Treatment options also depend on the many characteristics of the patient itself, their social conditions, what they are suffering from exactly. Sometimes the patient may have pain only, sometimes the patient may not have pain, but infertility will be the main issue. And in that case, we treat the patient accordingly. So other than the painkillers, first choice is painkillers itself. We have to try with painkillers first for 3 months. Most of them will have a pain relief, but obviously every month they will end up in taking painkillers. So next step, we have to assess the severity of the pain, and if the patient is already having kids and not planning for pregnancy now, we can put her on hormone treatment. Hormone treatment are many. We usually give oral contraceptive pills. That too, it is recommended that we have to give continuously without stopping in between. Like for contraception, we give monthly. For this endometriosis, we have to prevent the periods itself. Patient should not bleed. At least for 6 to 1 year, we can continue the treatment with hormones. Next hormone we usually give are the progestins. Progestins we give, there are oral tablets like Dynogest 2 mg. We can continue for 6 months to 2 years, and there are intrauterine devices with progesterone. With progestins, patients have significant reduction in their pain and heavy menstrual blood flow. Other methods which we treat the patients with medically are GnRH analogs and GnRH antagonists. Nowadays, new recommendations are GnRH antagonists are available orally also. Only problem is that they will cause too much side effects like hot flushes or anything hot flushes. They can affect the bone mineral density and it can increase the serum lipid levels like a patient who have already undergone menopause. So we will have to monitor them frequently, and if the patient is having symptomatic relief with these modalities, if we have to continue for more than 3 months, we will have to give them add-back therapy with other contraceptive or combined estrogen progesterone treatment support also.
And doctor, when do you suggest surgery for endometriosis?
We will suggest a surgery depending on the patient's requirement. That is, if the patient is having too much pain, this pain is the main issue, and if the patient is planning for fertility, we will advise them surgery. Surgery is usually laparoscopically, and we can see and treat the lesions. We usually do excision of the lesions, and if there are chocolate cysts, we have to remove the cyst wall as such. Rather than draining the chocolate fluid, we have to remove the cyst wall itself, and there will be adhesions, that is sticking of the structures in between, and which will distort the pelvic anatomy, which can cause blockage in the tubes. So we can do adhesiolysis, that is we will correct the adhesions we are restoring the pelvic anatomy. Thereby we can help the patient to relieve the pain, and we can try for a spontaneous conception for 6 months after surgery. But the thing is that surgery or medication, whatever, will give only a temporary relief for the patient, because the underlying problem is mainly inflammation or biochemical problems related to hormonal imbalance also. So we have to keep a follow-up, and we have to counsel the patient about the recurrence even after surgery.
Now, can you speak about lifestyle changes that can affect endometriosis?
Lifestyle changes are very important in the management of endometriosis, as it is a chronic inflammatory condition underlying problem. So even if we give hormones or surgery, the lifestyle changes is very important. Lifestyle changes include regarding the diet, especially diet. We should avoid all kind of processed refined foods, and there is a diet called anti-inflammatory diet, which is suggested especially in the case of endometriosis. In anti-inflammatory diet, they suggest not to take any kind of dairy products. Gluten should be avoided, and there are many foods that we think that it is good, which can cause more of histamine release in our body, which can cause this inflammatory processes. Like spicy food we have to avoid, fermented food we have to avoid, and any too much sour food, like too much intake of even oranges or lemons, like can cause the increase of pain. And it is said that fatty fish, that salmon and all, which with omega-3, more of omega-3 we should include, and colorful vegetables we should take, which can cause like more of antioxidants, which will help to reduce the inflammation. And vitamin D also, we should be checking the vitamin D levels. It is very important in maintaining a good immunity in our body. So other than that, we should always be physically active, and it is said that the patients who are physically active, especially doing aerobic exercises and all, strength training exercises, the rate of recurrence or the symptomatic relief is better than those who don't do physical activities. And obviously stress, we know stress can cause hormonal imbalances, can increase the level of cortisols or estrogen levels, which can cause this inflammatory process to trigger in or increase. So we have to do stress management by sleeping on time, trying to find our own time in between the busy schedule. We can do meditation, yoga, whichever way we can help to reduce the stress.
And Doctor, another important query is, how does endometriosis affect infertility? And is infertility the first sign of endometriosis?
Yes, sometimes patient will come only with infertility. Then when we end up in evaluating the patient, we diagnose the endometriosis because they may not have pain. Endometriosis cause the infertility in almost 33% of the women or the couple itself. It is said that in endometriosis, the quality of the egg or the quality of the embryo is affected, and because itself it is an inflammatory disease, the endometrium, that the embryo's implantation into the uterus is affected because of the decreased endometrial receptivity and the endometrial inflammation. And obviously we know that because of the adhesions it can cause a tubal blockage, and because of the tubal blockage patient can end up in having infertility also and ectopic pregnancies also.
Doctor, can someone have endometriosis and conceive naturally?
Of course, she can conceive spontaneously. No, it's not that endometriosis is there and the patient cannot conceive spontaneously. Actually, in a normal woman, the fecundity rate is 15 to 20%. That is the chance of her getting pregnant in a month. In a normal woman is 15 to 20%, but it is only 2 to 10% in a woman with endometriosis. It's not zero.
Does endometriosis increase the risk of miscarriage or pregnancy complications?
Endometriosis can cause miscarriages because the embryo quality is affected and the endometrial receptivity is also poor. They can cause early miscarriages. They can end up in having recurrent pregnancy loss. And as such, in pregnancy, throughout the pregnancy itself, there is a chance for preterm labor. The baby can have less weight, that is small for gestation. She is in high risk for hypertension in pregnancy, and there is a chance that after delivery, the placenta can get adherent to the uterus, especially if the patient is having adenomyosis. The placenta may not separate naturally after delivery.
And Doctor, can endometriosis come back after treatment?
It also depends on the patient characteristics because the surgery or hormonal treatment only give temporary relief, and as I mentioned before, lifestyle is very important. Those who don't follow a healthy lifestyle can end up in having recurrence, obviously, and the recurrence also may be very severe also. It is not like once surgery is done, you cannot have endometriosis, and you can, even with the hormone therapy, if you think that you have already taken treatment, it will never come back. It is nothing like that, because the underlying problem is still remaining in the body. So we have to follow a healthy lifestyle, like I told, an anti-inflammatory diet and exercise, and managing the stress is very important.
Doctor, when should someone with endometriosis consider IVF treatment?
IVF we usually recommend in endometriotic patients if they are already age is more, and if we see that their ovarian reserve is poor, that maybe because of her previous surgeries, or if there are in both sides, if there are ovarian cysts are there already, we usually recommend them IVF.
So should they go for egg or embryo freezing?
It's said that if you are in a stable relation, better go for embryo freezing itself than the egg preservation, because more success rates are seen in the embryo preservation than in the pregnancies following on embryo preservation than egg freezing.
How can families support the woman with endometriosis? What is the suggestion?
Actually, it is a very thoughtful question, because a woman who is suffering because of this endometriotic pain, they will be mentally also suffering a lot, because every month she has to go through this pain. They will have to end up in postponing the parties or family functions, or even she has to take sick leave from her work every month. It will cause it will affect her self-esteem itself, and her identity, and it can cause too much anxiety and even depression, and especially the relationship with the partner also, it can be affected because of the pain during the sex. So the main problem is that family should have open-mindedness, try to understand her situation and be in her shoes, and try to be with her and support her by all means, especially when she is in severe pain during the periods. Help her in the household chores, and try to prepare meals and take care of the child. Especially the partners can help her in those, and never tell that the pain is just something a woman can suffer, can tolerate. In some cases, in severe cases, the patient is going through anxiety and too much of mood fluctuations and depression. She may need of psychotherapy or cognitive behavioral therapy, and you have to support her throughout and take her for therapy, avoiding the stigma that others can end up in thinking that she have some mental illness or so. That is very important in the pain management of endometriosis. And infertility also, in case of infertility, never blame in case of fertility issues also, both couples should go for the treatment together, and try to make her understand also that it is because of the disease as such and not the problem with herself. Be with her and validate her pain, and try to support her by all means.
And finally, doctor, what is the one message you want our viewers to keep in mind after this discussion about endometriosis?
The only one message, if you ask, is that menstrual pain should not be so severe to affect the quality of her life. In case you are having too much painful periods, don't think that it is quite normal to have. Please take a medical advice and seek treatment and get the diagnosis of endometriosis earlier, so that you don't have to suffer throughout your life. You don't end up in having multiple surgeries, and you don't end up in having fertility issues in the future.
And doctor, before we wind up, what do you have to say about Al Hilal Healthcare Service?
In Al Hilal, we have multiple super specialities like urologists or gastrosurgeons with whom we can collaborate and help the patients to go through their endometriotic treatment.
Thank you, doctor. Thank you very much.
Thank you.
So to all the ladies watching out this program, if you have any symptoms of endometriosis, get yourself checked and go for treatment and improve your quality of life. I hope this episode was helpful. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is 𝑧𝑬𝑚𝑚𝑉𝑗𝑗 signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. 𝑧𝑬𝑚𝑚𝑉𝑗𝑗 protects your skin.